Hello, my name is Monica Aguirre with Prairie View A&M Cooperative Extension Program. September is National Suicide Prevention Month, and today we're going to be talking about this very sensitive topic. The following are some myths and facts of suicide. Myth number one: talking about suicide or asking someone if they feel suicidal will encourage suicide attempts. Myth number two: once an individual is suicidal, he or she will always remain suicidal. Myth number three: people who threaten suicide are just seeking attention. Myth number four: suicide only affects individuals with a mental health condition. Fact: talking about suicide provides the opportunity for communication. Fears shared are more likely to diminish. The first step in encouraging a person with thoughts of suicide to live comes from talking about those feelings. A simple inquiry about whether or not the person is intending to end their life can start the conversation. However, talking about suicide should be carefully managed. Fact: active suicidal ideation is often short-term and situation-specific. Studies have shown that approximately 54% of individuals who have died by suicide did not have a diagnosable mental health condition. And for those with mental illness, the proper treatment can help to reduce symptoms. The act of suicide is often an attempt to control deep, painful emotions and thoughts an individual is experiencing. Once these thoughts dissipate, so will the suicidal ideations. While suicidal thoughts can return, they are not permanent. An individual with suicidal thoughts and attempts can live a long, successful life. Fact: all suicide attempts must be treated as though the person has the intent to die. Do not dismiss a suicide attempt as simply being an attention-seeking device. It is likely the young person has tried to gain attention, and therefore this attention is needed. The attention they get may well save their lives. Fact: many individuals with mental illness are not affected by suicidal thoughts, and not all people who attempt or die by suicide have mental illness. Relationship problems and other life stressors, such as a criminal problem, legal matters, persecution, eviction or loss of a home, death of a loved one, a devastating or debilitating illness, trauma, sexual abuse, rejection, and recent or impending crisis are also associated with suicidal thoughts and attempts. Additional myths include most suicides happen suddenly or without warning. Also, a myth: people who die by suicide are selfish and take the easy way out. Fact: warning signs, verbally or behaviorally, precede most suicides. Therefore, it's important to learn and understand the warning signs associated with suicide. Many individuals who are suicidal may only show signs to those closest to them. These loved ones may not recognize what's going on, which is how it may seem like the suicide was sudden or without warning. Fact: typically, people do not die by suicide because they do not want to live. People die by suicide because they want to end their suffering. These individuals are suffering so deeply that they feel helpless and hopeless. Individuals who experience suicidal ideations do not do so by choice. They are not simply thinking of themselves, but rather they are going through a very serious mental health symptom due to their mental illness or due to a very difficult situation. Suicide facts for Texas in 2019. It is the 11th leading cause of death in Texas. It is the 5th leading cause of death for people between the ages of 45 and 54. It is the 4th leading cause of death for people between the ages of 35 and 44. And it is the 2nd leading cause of death for people between the ages of 15 to 34. Suicide warnings. You can't see what a person is feeling on the inside, so it isn't always easy to identify when someone is having suicidal thoughts. However, some outward warnings that a person may be contemplating suicide include the following. If a person talks about killing themselves, that is a warning sign. Or they express that they feel hopeless, or that they have no reason to live, or being a burden to others, or feeling trapped, or being in unbearable pain. Behaviors that may signal risk, especially if related to a painful event, loss, or change. Looking for a way to end their lives, such as searching online for methods, withdrawing from activities, isolating from family and friends, increased use of alcohol or drugs, sleeping too much or too little, visiting or calling people to say goodbye, giving away prized possessions, aggression or fatigue. People who are considering suicide often display one or more of the following moods: depression, anxiety, loss of interest, irritability, humiliation or shame, agitation or anger, relief, or sudden improvement. There's no single cause for suicide. Suicide most often occurs when stressors and health issues converge to create an experience of hopelessness and despair. Depression is the most common condition associated with suicide, and it is often undiagnosed or untreated. Risk factors are characteristics or conditions that increase the chance that a person may try to take their life. Health factors include mental health conditions such as depression, substance abuse, bipolar disorder, schizophrenia, personality traits of aggression or mood changes and poor relationships, conduct disorders, or anxiety disorders. Also, serious physical health conditions including pain or traumatic brain injury. Environmental factors: access to lethal means including firearms and drugs, prolonged stress such as harassment, bullying, relationship problems, or unemployment, stressful life events like rejection, divorce, financial crisis, other life transitions or loss, exposure to another person's suicide, or to graphic or sensationalized accounts of suicide. Historical factors: previous suicide attempts, family history of suicide, or childhood abuse, neglect, or trauma. Ask the question: are you thinking about suicide? Are you thinking of ending your life right now? Have you put a suicide plan into action? While it's scary to talk about suicide, especially with someone who is suicidal, remember that talking to a suicidal person can save his or her life. People who are experiencing suicidal ideations often feel alone, and by talking to him or her, you remind the person that you care and will help that person in his or her fight against suicide. Tips on starting the conversation: lean in. The only real way to know is to ask. If you observe behaviors or signs that worry you, ask. The worst thing that can happen if you're incorrect is that you may feel a little embarrassed. Suicidal thoughts are often significant red flags that something is wrong. Varying degrees of intensity are common for people going through hard times. When you feel your spidey senses tingle, or you wonder, should I be worried? Lean in, ask. Know your resources. Be familiar with the support resources you have in your community. Get comfortable feeling uncomfortable. For most people, asking about suicide is anxiety provoking, and that makes sense. Talking about life and death is intense. Notice and acknowledge your feelings, and do your best to get centered before you start the conversation. your physical and emotional presence will have a big impact on how the conversation goes. So take some deep breaths and focus your heart on compassion. Create a safe space. Find a place for privacy and comfort. Depending on the situation, this may mean taking a walk outside or finding a quiet place to sit down. Take cues from the person about physical proximity and intensity of eye contact. Some people prefer to talk shoulder to shoulder, others face to face. If you're sitting, make sure that your body language communicates openness and interest and that you've seated on a parallel level with the person you're talking to. Take time to turn off your phone or close the door as well, so you won't be interrupted. Start with, I've noticed. Thank them for taking the time to speak with you, and list the observations you've made that led you to be concerned. Speak about specific times and places where they were not themselves. Maybe you've noticed a change in mood, like they're much more irritable. Or maybe you've noticed a change in behavior, like they're drinking a lot more. Maybe you've learned that they recently separated from their spouse or partner. Practice active listening. Refrain from problem solving and giving advice. Instead, show them that they are being heard. Use encouragers like nodding your head or saying, uh-huh, and then what happened, to keep the conversation going. Suicide is a major public health concern. Over 48,000 people died by suicide in the United States in 2018. It is the 11th leading cause of death overall. Suicide is complicated and tragic, but it is often preventable. Knowing the warning signs for suicide and how to get help can help save lives. Thank you for joining us today. For more information, you can contact the National Suicide Prevention Lifeline, available 24 hours a day in English and in Spanish. The number is 1-800-273-8255.